still sleeping.
This will wake you up.
What's this thing? Having to go up in that one. If you can. Why? Look, it's easier to put this thing on the other end. That's a big head. Oh, buddy. Okay, we've added the anesthesia, and we're going to wrap him up with some latex here, keep it from seeping out.
But the anesthesia was in that cap?
No, it was in a syringe that was injected. There was a cotton ball on the inside of that cap, a little container. Okay, now it'll take about 10 minutes
Okay.
for him to go get knocked out. Okay, what I'm doing here now is counting the subcaudal scales. We know it's a male just by his body structure and so on, but we count this just to identify this particular snake, and we'll end up ultimately pit tagging him anyway. 1, 2, 3. Okay. I got 19. I got 19 subcaudal, Steve, which would appear, let's measure this snake, appear to be a female.
Right in here.
Yeah.
He got a couple of crooks here, so I'm going to give him a little inch and a half.
Yeah, easily. This is one of those exceptions because this is 45 inches. It's not a female. It's a male. You can tell by the body structure there too. It has a long tail, but it just has big scales. Do this one more time. 1, 2, 3, 4, 5, 6, 7, 19. 19.
Now, when you get a permit to take a rattlesnake,
Steve, I would call this snake is big for Ridge and Valley section, but it has the count, and I'm not going to probe it. It has the count of a female. I believe it's a male with the flat back and the indentation. Just
Size.
Howard Reinhardt said that works 95% of the time, and I think we may have found one of those snakes that are in that 5% group. If this snake would have been 36 inches or smaller snake, we'd have probably just called it a female, but because of the size, females don't get this big. So
do you know what the largest female that they have on record is? Or is it...
we've measured a couple 42 inches, but that is the exception. And yeah, they count as a female. This is 45 or 46, and those 42s all seem to come from one area in the state too. So where they just seem like they run a little bit bigger.
Now, for permit purposes, if someone were to find this snake and it was more than 42 inches in length but had 19 subcaudals, would it be
not a
illegal?
legal snake.
It would not be a legal
You
snake.
must have 21 or more subcaudals.
And be more than 42.
And be 42
Okay.
inch minimum. So this snake is not legal to take in Pennsylvania if somebody has a possession or snake hunter's venomous snake permit.
Okay.
Okay. What we're going to do now is move the snake from the anesthesia tube over into into this tube, or we do the surgery, however you want it there. Okay. Get some of this out of the way then. Here's this. Throw it on the table behind you. Okay.
So the only way to tell for sure would be to use a probe.
Use a probe and
Lift that up, and then I can do it better.
literally, and also too, with the size of this head, males have a big head compared to the females. This is definitely a male snake. He just doesn't have the subcaudal count, and as Howard Reinhardt says, it works 95% of the time. And, okay. Howard Reinhardt is a
That'll have to be
professor.
reloaded.
I don't even know where you put it.
Put it on there.
I don't know where the cap is. Probably the leading rattlesnake researcher in the eastern part of the United States, particularly for timber rattlesnakes. There's no cotton ball there. Need a cotton ball. There we go. Okay. And that's just a small maintenance dose to keep the snake out while we're performing the surgery. Okay, what I'm doing now, we have the snake prepared, the snake's anesthetized, and we've measured up a certain distance from the tail, put a mark here. That's where we want to make our incision in that area, just for the simple reason, based on the length of the snake, that is where the small intestines go into one large intestine, and we want to get the transmitter back in behind that. So now I'm using betadine to clean the snake up a little bit right here. We got our tools out of the ethyl alcohol. They're now here, dried. Make the incision. That one. You can't cut any of the scales. That's very important, not to cut the scales. And going through the muscle in the bottom here and getting in under the ribs.
Does it make it more difficult, given the fact that it's ready to shed?
Yeah, we're getting one layer of skin that's getting a little damp and peeling off, but that won't be much of a problem. We'll go to stitch it up and that'll correct it. Okay. I'm now through the coulemic membrane, and this is where the transmitter goes, right here. And transmitter goes right in here.
And it's small enough that it won't affect the snake's digestion or passing.
That's why we put it back where the the single large intestine is, and the snake will just do fine. Okay. Now, have to now remove these drapes. And what we need to do now is get the transmitter under the skin. I'll go a little further than that. Okay. Okay, so now what we're doing is running a catheter underneath the skin. Okay, right there, Dad. It's got to go up a scale, up one scale. Right in there. Okay. Punch the catheter right through. And now we're going to put the antenna up the catheter tube. Can you hold that in, please? Yeah. transmitter in position inside the colemic cavity. You can see the little hole how it closed up where the transmitter went in. And we're now going to remove the catheter. And that leaves the antenna under the skin. And now we are ready to close the snake up.
How many of these snakes have you?
Both directions, putting transmitters in and out, it's probably now close to 100.
100 different snakes or 100 different surgeries?
100 different surgeries, yeah. Theoretically, everything goes well. Each snake requires 2 surgeries, one in and one out, and one going in and one going out. Okay.
And that skin sticking up there, that's the dead skin from
That's
the shed that's going to come off.
and we're actually going to cut that little bit off. This snake is going to shed within a couple days, and this skin is just so ready to come off.
A snake this size with a head that size, could he eat a gray squirrel?
Probably a small gray squirrel, yes. Chipmunks easily, and young of the year gray squirrels. Small rabbits, weasels. I've seen them. One time a snake brought into one of the organized hunts regurgitated, I guess he got overheated and regurgitated a weasel. And, of course, the way a weasel shaped, perfect size for a good sized snake. And,
How old would you think this snake is?
look at the rattles here. The rattles are pretty even, uniform width, so it's a mature snake, that's for sure. This snake's probably 15 years, at least 15 years old. Once they get mature and all the rattles are the same width, it's sometimes quite difficult to tell exactly how old they are. Younger snakes pretty easy when they start out wide and taper down to a point. Good. And I'll need a gauze pad and a little bit of saline solution, and then I'll get those big scissors and trim this. The big scissors, are they here? Oh. And I get a dry pad then. This is skin that this snake would be shedding and will shed in a couple days. So dirty skin away from the. Okay. We need to weigh and pit tag these snakes.
I would like a light.
Okay. This is just going to pit tag the snake. What a pit tag is a little microchip that we put in the snake, similar to what is put in a dog or a pet, so you can identify them. We have a reader that reads the pit tag on the snake. That identification number will stay with the snake as long as the snake lives. Even after we remove the transmitter, the pit tag will still be in the snake. So there you go, and that goes into a Fish Commission database. We have over 2,000 snakes in the wild in Pennsylvania right now, 2,000 rattlesnakes that contain pit tags, and this will be another one. Okay.
Well,
We're now going to weigh the snake, and let me get the scale turned on. We know the box weighs 71 grams. There it is, 71. $1,278.
Is that a heavy snake?
Yeah, it's a good sized snake, a good heavy snake. Let me figure that out then. Right back.
well,
Recover, and we're done with our surgical procedure. Now it's simply reviving the snake.
I use that.
Okay, we are now in the revival process, and the snake is coming out of the anesthesia. You can see the tongue is flicking, and however, it's not forked at the end. He's still heavily sedated, but pretty quick recovery for the snake. Takes a while to get used to this because the experience, you never handle rattlesnake like this, and it's just the first time you do that with a sedated snake, it just kind of freaks you out because you just would never do this with a snake, and yet he's still in Never Never Land. But I think now very sensitive along the spine, so the snake is moving pretty good. Tongue's flicking. What we'll do now is just give it a little bit of time to recover. The anesthesia has to get out of its system, so we'll put it in an open air container. Actually, it's nothing more than a collapsible hamper that we put them in so that they can come out of the anesthesia and we can keep an eye on them. Put this thing in here. And now to just take the snake's moving a little bit, but it'll take it a while, half an hour, 45 minutes to really come out of it. But we work with them to get them moving and the tongue flicking so that they're breathing again, so that you don't end up with an anesthesia relapse or something like that. That they stop breathing. So that's about it. Very docile snake right now. Once he comes out of recovery, he'll get back to normal pretty quick. So he'll have about a 1-day recovery period, and then the snake, he'll be ready to be released and tracked for the rest of the summer and lead us to hopefully a real good communal den in the area within a mile or two of where this snake was captured. Okay, the snake has now come out of the anesthesia and quite active. See, he's pretty good. Not rattling or anything, but he's moving around quite a lot, flicking the tongue. And now the only thing we have to do is check the transmitter, and we know the frequency of that snake. Let's see here. There we go. So that's the signal that this snake is giving off, and we'll be able to track it with an antenna, a directional antenna, and be able to monitor where this snake moves and ultimately where it hibernates in the fall. Hopefully it'll lead us to a real good communal den, and in an area, it is the snake was captured in what we call a gap area, an area that we have no data on rattlesnakes, although they're in the area. We just haven't pinpointed any critical habitat. So hopefully now through this rattlesnake, he'll lead us to an area of critical habitat and a good overwintering den location. Next spring we'll recover the snake, or Steve Schaefer will recover the snake and bring it back over here, and we'll remove the transmitter and then release the snake where it was captured. So and then he'll live the rest of his life normally. But this year he'll be doing what he always does and travel where he wants to go, and we'll just be kind of in the shadows, following along the way. And then in end of September, early October, he'll head to his overwintering den.
Now, can he hear or feel any of the frequencies coming off of that transmitter? Is that creating vibration?
It's just a radio signal that it's sending, and we find them just doing their normal thing, coiled up against a log in a foraging position. A lot of the times with males, we'll find them in mating season with females and so on. They seem to recover really quickly from the surgery. Within a couple of days, they're back to their normal pattern and on the go and feeding and moving throughout the forest again.
So I can hold him for a couple days and maybe release him on Friday?
That would probably be good. He'll be good in healing of already stayed. They heal very, very fast when they're up to temperature. We don't install transmitters generally after August 15th, just because it doesn't give them enough time before it starts cooling in the fall to heal up properly. But this time of the year, when it's good and warm, they heal very quickly.